So I'm Simon Baron-Cohen, and I'm the director of the Autism Research Centre here at Cambridge University. I'm a professor in two departments, the Department of Psychology and Psychiatry. And I first got involved with Blue Smile at its beginning, really. So 2010, as an advisor, because I work in the field of mental health and neurodevelopmental disability. And in various different roles since then. And I have to say, I'm really proud to be associated with Blue Smile. So the reason I got involved was I could see, even in the early days, that Blue Smile was filling a void for children and their mental health. And also Blue Smile it had the vision of recognizing that where they could make their contribution was directly in schools with children. And it was very important because, as we now know, 1 in 5 children experience challenges with their mental health. That's 20% of kids. I mean, that's huge. And there's no way that the NHS can meet that need because of all the resource limitations that we know about. So the charity was taking some of that pressure off the NHS, but also meeting children where they are, where they spend most of their working day, in the playground, in classrooms, break time, just going to where children are. My work in the field of autism also made me realize that it's not 1 in 5 autistic children who experience poor mental health. Sadly, the situation is much more worrying. It may be as high as 3/4 of autistic children experience at some point depression or anxiety. So for them, this need for extra support is even more pressing, shall we say. And again, the NHS just can't begin to meet the scale of the need. Autism is 1 in 30 children, for example. And that's only one example of what's nowadays called neurodivergence. We can also think about children who are not just autistic, but might have other disabilities like ADHD or dyslexia. But back to the children that Blue Smile are helping. If you think about, there will always be, sadly, children who've experienced loss and grief and bereavement, and they need extra help. That's part of the human condition. Adults, our mental health fluctuates. The same is going to be true for children. So we absolutely need charities like Blue Smile. But what I'm really pleased about is here we are 15 years later, 2025. We're in the 15th birthday year of the charity, and we're here in Downing College to celebrate the amazing work that Blue Smile has done. From my understanding, it's working in 83 schools across Cambridgeshire. It's helped over 3,000 children, young children, whether it's one-to-one therapy or in group therapy. I mean, this is an amazing resource, and we just have to look after it.